Thank you, Kiona, and welcome everybody to our RHI educational webinar, An Introduction to the Science of Networks with Dr. Danielle Varda. We are really pleased to have Danielle with us today. She's the co-founder of the Visible Network Labs and co-director of the Center on Network Science at the University of Colorado Denver School of Public Affairs. Dr. Varda created the Partner Tool for Network Analysis in 2011 and implemented it with more than 2,500 networks in all 50 states. She has written numerous publications and spoken extensively on topics like network leadership, network evaluation, and network analysis. In a short moment, in a quick think, we can all consider and imagine the immense diversity of networks that are forming all across our country. We know that networks are born out of the needs of their rural communities, especially during these complex times of change and transition within the healthcare environment. But we want to know more about how to strategically build robust networks and how to measure and evaluate the effectiveness of networks. We need to learn more about the science of networks. In a recent Rural Health Network Development Grantee Workshop, grantees learned not only about basic network science, but also how to visualize and study their own networks to leverage key strategies. The network leaders mapped the current state of their networks, and then they mapped the ideal state of their networks. This exercise created an opportunity for those leaders to strategically think about network relationships. The result of this kind of networking thinking opens the door for figuring out how to be strategic in managing networks and how to measure and evaluate the strength and vitality of those networks. During this webinar with Dr. Varda, we want to learn how networks form. We want to try to figure out what are those strategies that guide effective networks and to consider what data is needed to manage networks strategically. We are really pleased to be presenting this webinar to you folks at FORHP. Thank you very much for taking time out of your day and joining us. Danielle, I'd like to pass over to you. I'm going to switch into our webinar presentation format, and it's all yours.
Great. Well, good morning, everyone. It is a great pleasure to be here and such an honor to work with all of the team that does all the hard work to put all of these things on. I've been a huge fan of CAPS for many years, and it's been a great pleasure to get to work with her now. CAP, I'm not seeing the webinar slides up yet.
Is it still spinning for you?
No, it just has the welcome text on the front slide.
Okay, I'm going to just switch back the template, and now I'm going to go back to the webinar.
Okay.
PowerPoint. Do you see it spinning?
Yeah. Oh, I got it now. Sorry. Okay, so thank you, everyone. Sorry for that delay. So I am a network scientist, which is a name I never knew that I would get to have, you know, while going through all of my schooling. But I do run a company that does technology development and work on helping people in communities translate data and concepts like this into practice, especially in strategies around building networks. So one of the reasons that I'm able to have a job like this is because there is this new norm that we call the network way of working that's just really everywhere now across organizations. So one of the places where the network way of working was first formalized was in public health, where we learned in the 10 essential services of public health that reaching across boundaries was an essential service, and to be accredited, we now know that we get reviewed by how well we do this work, and it's just really been a place where organizations, whether you're in the public, private, or nonprofit sector, are all coming together now, and in a belief that if we do things together, we will accomplish more than if we did it alone. What's really kind of remarkable about this is the way it's even changing our workforce. So where we used to have, say, an epidemiologist come into a public health department, and do that work for the specialty that they know well, we're now asking people like that and across all kinds of different skill sets to also engage in working with others, partnering, bridging across boundaries, because we find that we might have information when we do that work that we couldn't have if we just stuck to our own silos. So there's all kinds of different reasons why people are doing this work today, and it's just become a really important skill set that we need to start thinking about and how to build in people that we don't typically have a really good resource for. So trainings like ones that Cap just described and things like this are great ways for people to start becoming a little more oriented with this work. Just to be really clear, when I'm talking about networks, I'm actually conceptualizing them as nodes and lines. And so networks can be anything. Some people refer to them as collective impact or coalitions or collaboration, partnerships. There's all kinds of ways that we refer to this. And just to make it easy, I'm kind of calling all of these things networks. And these networks have nodes, which in this picture here look like circles. And those can be organizations or people. They can be things and ideas if you're really looking at big systems. And what we're interested in not only are the characteristics of those nodes, but the relationships between them. So these lines represent some way that the nodes are connected. And that can be a definition of as easy as like who is a friend of whom. In more of our work environments, it's things like what kinds of relationships do we have? Are we exchanging client referrals? Are we connecting for information sharing? However we define that. But when we're thinking about networks from a network science lens, we're thinking about networks in this way. So these can be small groups of organizations that are working together around an issue. It can be whole health systems that are really thinking about how we navigate people and patients through those systems and how they're connected to resources and organizations in the community. And you can start to map all of that work in these visuals and most importantly get really solid high quality data on the other side of them to really start to understand some patterns and ways in which we might use this information to in our thinking. So something I love to kind of talk about is this growth of networks has been really quick. It doesn't mean that thinking on networks is new, though. This is one of my favorite people that I admire, Elinor Ostrom, who wrote about free riders and collective action years ago and won the Nobel Peace Prize for this. And there's just been a huge body of literature where people have been talking about networks as a form of organization or a way of working for some time. But it really was in the more recent years with the labeling of a lot of this as collective impact that it became a little bit more mainstream. People had a common language, they really knew how to fund it. But what we're seeing now is some people kind of questioning that model and wondering if that's the best way, which is exactly where we should be in all of this work, really at a point of deeper understanding of what works and what doesn't. But as a result of all of this growth and this quick uptick of people adopting networks, they're happening everywhere, and people in our communities are being asked to participate in them, and our rural communities are especially affected by this when they're being asked to participate in multiple networks, often the same, small group of 20 people and organizations on multiple types of initiatives. And what's resulted in is what we call, and this is the prettiest picture I've been able to find of my graveyard, but kind of this graveyard where networks can go to die if we're not more thoughtful and careful about how we are planning them, organizing them, resourcing them, and moving them forward. So this presentation is really to think strategically and present some ideas strategically about how we prevent overloading our communities with network strategies and doing it in a way that might have some kind of alternative concept. So we have this quick poll for you. Just to kind of find out how many of you think or believe or know that you're familiar with strategies that build strong networks. So I'm not really going to define that for everyone now, but if you can just put a little bit of information in there, we'll get some idea how well people think that this is something they already incorporate into some of their work and thinking. Okay, great. So it's not surprising to me that a lot of people don't put a great deal or none, actually. I understand this is an audience of network leaders and managers, and so it's great to see the feedback there. So Terrific. So I'm going to go ahead and go on. It looks like we're about, half of the group saying a fair amount and a half, saying a small amount and a fair amount, which is great. So it means that there's some thinking happening, but maybe some room for some new information here. So that's what I'm hoping to offer today, is a way for us to bring in some new ideas about how to think about that. So this was a promise here that we were going to talk about network science, and the big secret I'm going to unveil here is that network science is a very simple concept, actually. It's the science of how things are connected, and so it's super intuitive. It's something that we live and do every day. I'd go so far as to say we're doing it on this call right now. All of us together are trying to navigate this new relationship that we have and the relationships that we have all around us. And so it's the kind of science that we're actually processing all of the time, but we might just not have the words for it yet. But a basic network science principle that I really love to think through and talk about is this idea that more is not always better. So, and it really is an interesting kind of counterintuitive principle to the way that we're more commonly taught and even intuitively think about how we should build networks. So networks feel good because we think that there's something valuable in connection, and so we get kind of distracted with this idea that more is better. So if we build up more and more connections, that we're going to have a better outcome. But I want to present an alternative idea to you for a second. So everyone on the phone, I want you to kind of focus on this yellow node that says you right now, and I just want you to think about yourself and who you connect with, and not you at your organization and you as a big, managing a big network, but you as a person and the people that you surround yourself with. They're often people who we find that we're attracted to and want to connect with because they are a lot like us. They have access to similar resources. They often enjoy the same things we do. They might have similar political views, all kinds of different reasons why we pick to be with people. But we tend to call those our strong ties, and those are connections to people. The natural way that we kind of form networks is by this concept called homophily, this idea that birds of a feather flock together. And so we naturally tend to form connections in these little social sub-networks where we're all connected. And what's happening even on this call is that we're a bunch of people who are all embedded in little social sub-networks. But what's happening more and more is that these sub-networks are starting to cross. So from social media, this network way of working, we're getting all this messaging and ways and platforms for doing this. So that feels great, and we call those little dotted kind of lighter lines our weak ties. Weak ties are meant to be ties that connect those social sub-networks, the strong ties groups, to each other. And this has come to be a concept known as the strength of weak ties. There was a guy, Mark Granovetter. He is a sociologist that in the 70s did his dissertation work on how people get jobs. And his hypothesis that we get jobs because of people we know and connections that we have was interesting, but what's more interesting was that he found that we don't really get jobs from these strong social sub-networks, but we really get jobs from these connections to these other sub-networks because the people in our social sub-networks tend to know about the same things we do. We kind of all live in our own little information bubbles. And so when we connect across those social sub-networks, we start to get information that's diverse and things we didn't know about. So he called that the strength of weak ties, and that's been an amazing kind of revolution in how we think about networks and why we find them valuable and can justify, why we think we should put resources into them, which is all good, but it can feel kind of chaotic and overwhelming, especially as an organization. So this little picture in the middle is an alternative to thinking about that. There was another guy, Ron Burt, he is a business guy, and he said, I love this concept, I love the idea of leveraging a collaborative advantage, but it's overwhelming and not very efficient and effective. So an alternative might be that we think about these social sub-networks and find one organization or person to connect to, the orange nodes there, that may be the most trusted, well-connected person, maybe a gatekeeper to a hard-to-reach population, or someone, one policymaker or, legislative aid connected to a group of policy for advocacy. But what he says is we can think networks this way. We can actually put less resources in, making room for new relationships to new sub-networks, and we'll get a greater collaborative advantage. And so it's pretty clear probably to all of us that you can't just start your networking work over here on the right side thinking you can figure all of this out. It takes a lot of work kind of over here on the left side to get through that and understand the nature and quality of relationships and who's connected to whom. But the idea here is that if you can start thinking this way, that you may be able to start approaching your network work in a whole different way. So just a quick example, a lot of funders and policymakers and so forth are asking people in communities to build networks. You can imagine that after 6 months, describe what kind of work your network has been building, and most people do provide a list of members and how often they meet. We call it counting noses. And the only expectation, the only way we can really beat that list at year one check-in, say, is to continually increase the size of that list and meetings. And that's super overwhelming for communities. It's not a really sustainable way to build out a network. So imagine if instead you reported, the left side image at 6 months. At a year, you start to say, look, we're reaching our goal of using fewer resources but with a greater collaborative advantage, and we can describe what kinds of relationships we have rather than just counting noses and giving you lists of partners. So this is a way of thinking. It's a network science foundation in changing kind of a mind shift from going from more is better to maybe more is not always better. And it's a really neat, and I hope that people at this point will start to say, like, wait, maybe I can manage these relationships to create a network strategy, to be more efficient, to be more effective. But I really believe that you have to have data to do it. So I'm going to talk a little bit here about data and how you might use it in different ways. Right before we get into that, I want to answer this question that hopefully is on your mind, like, what is a network strategy? So this is an example of a potential network strategy. We call it a model of a sustainable network because we've been doing research on networks over years. And what we have found is that when networks tend to evolve this way, they tend to stay together more often. So here I'm going to walk you through these phases, but first for a moment, just look here in the middle where these dots are that are in the circle. So if you look here, every little circle and square are in the same position in every picture that I've created around it. So what's interesting here is that the nodes, the actors of the network don't change, but the way that they're connecting do. And the way that they connect and the level of those connections matters a lot in the outcomes of these networks. And so let's say here, let's start at phase one. Let's say a funder comes along, sounds familiar, right, and says, we're going to take a network approach, so build a network. Usually what a group will do is they'll bring together pretty much everyone they know that they can identify, and they'll ask them to come together to start thinking about that network building. And then very quickly they'll usually put together a list of people that are not yet at the table, that they may not already be included. And real quickly, maybe meeting two, they'll invite them in, and we'll start trying to bridge those sub-networks. That's very common, and then if you go down to phase three, what happens is networks start to interact all of the time, and we're getting that messaging that more is better, and we have a monthly meeting, and we're just really trying to figure out how to keep everyone engaged to do something, right? So I would say most networks that I encounter, and I think most that are happening right now, are sitting here in phase three and not moving really very far out of it. And this has become a really frustrating thing for a lot of people because we're in a lot of phase three networks, and it doesn't really, we can't really see the outcome. We can't really see where we're going. And so you tend to maybe lose people in this sense. People start to wonder what we're doing. We might even become reliant on, let's say, a backbone organization, and then we have that free rider problem happening that Eleanor Ostrom taught us about so long ago. So an alternative to this, let's go to phase four here, is and not the way that all networks should be structured by any means, but just a way to think about it. Let's say this network, after a while, did some data, did some prioritizing, came up with 4 priority areas they wanted to work on. They assigned people to a role within each one. They found some bridging kind of key players in here who maybe were really trusted, maybe had more time. For any reasons, they were valued as these kinds of strategic kind of bridging organizations. And the network ran this way. Let's say one of these sub-networks runs once a month, meets once a month. Some of them meet quarterly, maybe once a year, and maybe occasionally, like once or twice a year, everyone comes together again. But the idea here is that when you get to this phase 4, you've completely changed and you've built a strategy. And the strategy is based on everyone having a role, being invited to play that role only when they need to, and being optional other times, and kind of going forward with a strategy that says we're going to try to run this network with the least amount of resources, but to reach the same collaborative advantage. And those resources might be phase 3 forever. That might be a good strategy. But more often people are losing funding or trying to figure out what to do when the funding and initiative leaves, and how do we sustain. And what we have found is over time, people will go from phase 3 to phase 4. When they go to phase 4, they're more likely to stay involved and engaged in the network because they believe that their time is really valuable and articulated by the leadership that way. And one thing I like to do just for fun is to talk about this in a little bit less academic way and a little bit more of a real life way. So real quick, I'll just present this as a slide that I've created about 12 years ago. I got married. And, you know, I said when I started this that we're all doing network science and we're doing it every day, all the time. So this is one way we use network science in planning a wedding. So just to explain what's happening here, these are all the people that attended my wedding. And when I was planning it, I was trying to figure out kind of this, you know, puzzle of where to seat people. And so I ended up saying to my husband, you know, this is confusing. We don't know if we should put people who know each other together. We don't know if we should go with the other theory that if we put, you know, mix up people, they'll get, you know, everyone will get to meet each other and our friends will just love each other. So I put it into my networks program and just basically connected at least one person to every other person, at least one person to at least one connection they had that we knew of, and I color-coded them. And I visualized it, which is so fun when you're doing network data work. And it was great because I could instantly see a little bit of pattern where I could start building some 8-tops and just put together people this way. But almost more importantly, when I really stepped back and looked at this, I saw something that I hadn't known before. And that was this little pattern here, which hopefully you can see my mouse. This is what we call a whole component. It's where everyone in the network has at least one connection to someone else. These are our isolates, but they're part of the network. These were our single folks who were coming alone to the wedding. And then this is my family, whoops, I just kind of gave one away, but so this is a component here. And this is what we call more open network, where things are not all connected. What I learned and figured out real quick was this component is most of my husband's friends and family, and they were all connected to each other. And over here is my family, high school or college friends, AmeriCorps friends, kayaking friends, and it just made me step back and realize, wow, we have a network that are networks that are very different. He's coming to this marriage with a very closed network of people who all tend to really be connected to each other and know each other well. And my network is very different, where people actually don't tend to all know each other and are really disconnected. And so when I look at this, I tried to make sense of it. I think it might be that his roots from the Midwest, where I have learned that a lot of people are really closely connected for many, many years, might be one of the reasons why this looks this way. I'm from El Paso, Texas, where I think we had a little more of a mindset of, you know, fly out and spread our wings and see, you know, what's out in the world. And there's not as many, I think, home root connections in a place like where I grew up. And so that could be untrue, I'm not sure, but it was a really great way to actually start thinking about this big, you know, relationship I was getting into with all of the people. And it's amazing how this has actually turned out. So it's turned out to be, oh, I just saw the note that you're not seeing my mouse, so that must be really confusing. Let me see if now I have a pointer. Here we go. This was the component that I was trying to talk about right here. This was my family, and these are my subgroups. So just to make it a little bit easier to see, I'll backtrack on that. But this was the completely connected component there. So anyways, one reason I like to really bring that out is that we do network science all of the time. So I can sound really academic. I know, you know, I come from science perspective, but, you know, the true way that we're interacting in the world is really with a network science lens. And so what I'm going to switch to now is a research example, so you can kind of see how this played out in a health kind of public health setting. But this is just one of my favorite things to get to present. And actually, when I get to do this live with people, I love to kind of see how it resonates with people. So just a couple main takeaways before I finish with an example. So building and managing a network doesn't have to be left to chance. There is a science to help guide it. Everyone on this phone is already a network scientist, and you use network science every day. You can manage network relationships to develop a strategy, but you probably need some data to do it. There's no reason to leave this to chance. I know we're humans and we know how to connect, but if you're like me at all, you know, social relationships are just hard, and trying to translate that into our work relationships across communities and boundaries, you know, knowing there's a science to help us with that is actually comforting to me. More networking is not better networking. You can identify redundancy and holes in your network, and that can really inform your strategy on how to either build it up or take it apart a little bit. And what we have found is a proven strategy for network sustainability is that one in which everyone in the network has a role they understand. Participation only is required when that role is needed, and otherwise it's optional. The network has a stated goal that the end includes a strategy to use the fewest number of resources to reach the same collaborative advantage. And again, I can't emphasize enough that, like, there is no one best way here. It takes a lot of work. Cap mentioned at the beginning, you know, doing an exercise, for example, where you might, at this point, articulate what your ideal network is. And so when we do this in real life, if you want to go back and start drawing your little network, you know, or they're big networks, but drawing little pictures of networks, building them and so forth, it's a really great next step before you start to invest more resources and ask people to come more and more to these kinds of things. We really do suggest that folks take a minute and try to build that network strategy. So I'll end here. I'm going to spend just a few minutes on kind of a real-world application of network science. What I'm going to talk about is a project that we did on a group called Wonder Babies, which was a project in Colorado that was meant to strengthen the system of care for babies and young children with special health care and developmental needs. I was connected with a person, Dr. Ayelet Talmi, at Children's Hospital, who is a pediatric psychologist, and she said, I am working hard to work on this system of care with all these partners, and I think you do this mapping and network stuff, and could we merge those two ideas to see what we come up with? And it was a great idea. The problem that we were trying to solve for is one that I think many of you are going to be really familiar with. This is a picture that we actually pulled from the internet of a woman's network that she drew to describe her network for helping and supporting her family with children with special health care needs. And obviously it's complicated, it's huge, and very, very difficult to navigate. So we're constantly trying to think about how to make that easier and better for people. I'm going to show you some things here that uses a method called social network analysis. It's a method that collects data on who's connected to whom, how the connections vary and change, and a focus on patterns of relationships, and then descriptions of those relationships, like the type, extent of them, the quality of those connections. I've already talked about there being nodes and lines and what those are, but just real quick on the map on the right, if I had given a survey, say to all those people, and I had said, who are you a friend to on a scale of 1 to 3, we would see that Garth said he was a friend to Bill because there's an arrow going that way, and we can even label that line. We don't see that Bill said he was a friend of Garth, so he might not think Garth is a friend. He might just define friendship differently, or he might not have answered the survey. But that's how a survey gets turned into these visuals. There's a little special way of coding the data, and then you can turn almost any relationship into these maps. So that's the method I'm going to, you'll be seeing a little bit of here in these slides. We use this thing called the partner platform. It's what Kat mentioned in the beginning. It's a social network analysis data capturing tool. We call it a data tracking and learning system that allows someone to either do a one-time survey and an evaluation to get that data in, or we're just building and opening a way that people can continuously track their networks and systems over time. But what's really important to us is the network learning part that goes with it. It stands for the Program to Analyze, Record, and Track Networks to Enhance Relationships. So just a little background on that. It was funded by the Robert Wood Johnson Foundation for 7 years, used in over 4,000 communities, and it just created this huge data set of people who have agreed to put their data in there that's allowing us to learn a lot more about networks. It does the kind of thing that I've just been talking about, you know, how to measure these kinds of relationships and visualize them. So we did that. We asked a whole bunch of partners in Colorado who were involved in the system of care. Well, we started with the 12 Wonder Babies partners. We asked them to generate a list of others, and then we asked those people to generate another list, and then we send that survey out to people and ask them a number of questions about how they work together to coordinate care. What you're seeing here is the result of that. So this was the system of care for families in Colorado, and even though this is not geographically mapped out here, these did turn out to be more of our urban areas, and more of our rural areas do tend to be on the periphery. This is called the core and the periphery. So what we started to see right away is we were like, wow, this is really great. We're seeing a ton of connections, a lot of people saying that they're doing a lot of things together. We went to all of the data and we said, hey, we've got this data, how can it be useful for you? So, and one thing I didn't mention is I'm not really going to go through all of the results per se, but a few of our aha moments, why this kind of approach and this kind of lens really came back to us with learning in ways that we would not have had we not taken this approach. So this is kind of the story of those ahas. So in this case, we were out in the community and the mental health folks said, hey, where are the mental health agencies in this network? Can you show them to us? So we went back, pulled this map together, which the blue nodes are actually the mental health agencies. So the good news is we saw that they were kind of spread out all over, and there was some present in almost every part of the state. But if I took all those yellow nodes away, we would actually see a real lack of connection between the blue nodes. So what we learned is that they are covered across the state in at least a minimal way, but there's not very much connectivity between these organizations. So everything I say, you know, every data point should translate into an action step. So this got us really thinking, you know, should we be thinking more about how to coordinate mental health care, as an example. We also had people ask us to pull out their counties. So on the left, you're seeing Tri-County in Colorado, which is a big county where everyone's connected. The orange nodes are located in the county. The black nodes are outside of the county. The right side of the slide here is Weld County, where, you know, I talked about components. They actually have 2 components, which in this case may not be the best thing when you're a very rural area. And so the yellow nodes are Weld County organizations, and some of them didn't even report connections to each other. So lots of work and thinking, and we start to kind of break down that network, and it was really great to go out around the state and do this work. This is the exercise that we do with folks on trying to build their ideal networks. So we did that with people. We asked them to identify and help us understand what the ideal network, the ideal system of care for babies and young children in Colorado was. And people did it. They loved it. I think systems people love doing this kind of work. And it was really fun to go through that process with people. So where things kind of got, where things changed was when we went to families. So we went to families in the system and we said, we have all this great data. You know, look at how great it is. You know, how can we use this? Is there ways that it can help you and your family think about navigating the system? So families looked at the data and they didn't like it. They said, hey, this is showing us, showing connectivity and some kind of coordination that we are not experiencing. And when we asked them to do the same exercise of the boards and rubber bands, you know, what they said to us is one mom took her ball of rubber bands, put it at the top of the board and said, look, my social support system comes from my friends and family, other families, online support groups, my church, maybe my doctor. In her case, she said my insurance agencies, and she said, and that system to me is just a big ball of rubber bands, and I don't really care how it runs. All I know is that when I need something, I want an easy way to get to it. So we had this huge aha moment where we were like, wait a minute, we've been measuring good systems as the whole big system map. And what we started to realize was that we didn't really, in fact, they asked us, we didn't actually have a family node in our big network picture. And so in that moment, we asked family members, we had that aha moment, we asked family members to start drawing their networks, and they started, this is a slide of a mother who has twins with special health care needs, and she was drawing her pictures, and you can see in the red square, these are who she considered her close, most important ties to help her navigate care, and it's all her informal support. Her big, complicated formal support network is on the periphery, and this pattern we saw over and over again. We started doing surveys with families to see if we could start to better understand how they interact with systems and things like that. And we got data, and when we just put it side by side, the system map looks real different from our family networks, which have key nodes that say things like immediate family, school personnel, friends, pediatrician. And over here, these are all acronyms because they're almost all government or some kind of agency that provides services a much more formal or providers who a much more formal connection. So that led us to say, what are the patterns that we can find? And by disease, by zip code, we could not find a pattern in families' personal support networks, meaning they are that different. Literally, each of us on this call have some such different forms of social support. It's like invisible. But we did learn that families have a preference for tapping into their informal supports first and then going to use a system when that's not enough. And that people want to help themselves and they want to be resilient and not dependent on a burden. And those were really strong sentiments that families said when engaging with us on this work. And then we said, great, this is interesting, but how can we use it to help people? So we started asking, well, why are we expecting people to fit into these systems, and why don't we expect the system to fit around people? And we went so far to say, we think if the system is coordinated, then it should be reflected in these personal networks of family. So our new outcome measure was that when 100% of families say their personal networks are coordinated, then we know that system is working. So what that led us to do is say, well, how the heck are we going to understand personal support networks better so that then we can build these adaptive systems? And I used to end my presentations there and say, well, one day I'm going to build a tool that would help a provider understand a personal support network and use that in a person's care. Luckily, I was invited to participate in something called the Innovator Society, where we got to pitch an idea, and our team won $65,000, and we built this app called the Person-Centered Network app, and it allows us to do just that. This is a tool that allows, it's actually a data collection tool, just like all of our other stuff, but the case use that it's built within is a tool to assess the strengths and gaps in a person's personal support network, allowing providers or counselors or care coordinators to use the information and make more personalized assessments of a person's needs. So it actually works like this. It's a way that we have people, so people use it in clinical settings. We've had firefighters use it, home visitors, teachers in schools, all kinds of places we're trying to pilot it. But we ask people to list the things that they're struggling with, like their social determinants, and then ask them to rate their own health, to rate how lonely or isolated they feel, and then we prompt them with the question, well, who do you rely on when you have problems? And they create a little map like this, and with their finger, we ask them, for example, who can help coordinate care for you when you need it? And we start to instantly see whether this person is embedded in a coordinated network of care or not. And we ask two questions: to what degree do you depend on this person to help you when you need it, and to what degree do you trust them? Because even though they may say they're connected, people will report variations in level of trust and dependency, and we're building a social connectedness score, risk score, that is based on a lot of research we're doing, but kind of our highest risk patient would have low trust and high dependency with most of its connections. So you can imagine that's not a great state. When we ask people what are the things they need, we use that information that we learned from our research that said people want to help themselves first. So before referring them to resources in the system, we stop, just pause. It's very simple, and we say, who helps you with the things you need? And they let us see what kinds of issues, say child-related issues, employment, and food, they may be dealing with, so that they self-identify, but then they also tell us who's helping. So in this case, we may say to the patient, it looks great. It looks like you are getting help with some stuff you're identified around your kids, and all of those connections look really healthy, but you may be having, less help with food, but no help with employment. So let's focus on that. And what we've learned on referrals with people is that if we can focus on their most pressing need with the least amount of social support and help them navigate to that, they're more likely to follow through than were we to just say, great, you listed 3 things, let's get you connected to those 3 things. So it's been a really fascinating kind of learning that we've gone through, and this is kind of my last slide on this. We have discovered all these other ways to use this kind of thinking. So by applying a network science lens to these bigger problems, we also took this is my daughter Olivia when she was 8, asking me to use that app because kids love it. You hand them a tablet and they lean in really hard to it. So she used it, and when she described what she was struggling with, she rated her health, she rates how lonely or isolated she is. Then she draws a support network and tells me who she trusts and values and who she thinks is helping her with certain things. It's a little remarkable because I'm her mother and a network scientist, and I think that I know her really well. And when I got that the first time, I was really floored by how much I didn't know and learned from just that kind of interaction with a child. So we turned around and took it to a bunch of kids, social workers in schools, and revised that list. I don't know if you can see it, but the list that kids pick from are things like schoolwork, confidence, getting angry, being hungry, being bullied. And those things are things kids put in there, and then they really think through those questions of, if they have social support or not. And we're actually building an online resource database for them that's evidence-based and age-appropriate, where they can click on the node, and if they put, for example, being angry, it can take them to calming down exercises. So really neat to innovate and be able to think of all the use cases for this kind of approach. What we're ultimately doing is linking all of these things together in our, back end, where we look at this. For example, if this is the 4th grade at her school, we can start to look at this and see what are the trends across what kids say they need, or what people in clinics and hospitals say they need, what kinds of social support are they experiencing or not, so we can build interventions at the population level that are really targeted and informed by those kinds of very typically invisible factors about our communities and the people in them. These network approaches and network science allows us to make these invisible social structures really visible to us, and we just believe strongly that there is so much power and work we can do when we can get better at these approaches. So we're just part of that work. So I'm going to go ahead and stop there. I definitely wanted to make sure there was time for questions. I really love talking through these things, so if anyone has a specific question about something that they are working with in their own communities, I'm happy to answer that. Kep, I might have jumped to questions before you meant me to. Oh, great. Let's see here. So I do see a question. Repeat the name of the app. Sure, it's called the Person-Centered Network app. One of my flaws is I name everything by what it does. I'm not a very good startup kind of person in that way. So that's what it's called. It's on the App Store. It is so that you all do understand that it is designed so that providers it's meant so that a provider, we call them the helping professionals, administer it to a group of patients or people. It's not designed yet so that you would download it and answer it yourself. But if you do download it, you can create a registration, and it'll give you some, sample spots, and you can load in your name or other people's names and pick what's loaded in as a social determinants of health survey. So
that's great,
we're happy to
Danielle.
help with that. Thanks.
I had muted myself, so now my voice is now available. Monica also had a question there around particularly assessing coalitions and communities for them to monitor progress through the phases.
Yeah. And so that system that I talked about earlier called Partner, that's where that is a toolkit and a data system. And we're actually building an online course that we're hoping to launch in January that will walk someone through. We call it these 5 phases of building the network strategy and using data like this And so the partner tool was developed as like a SurveyMonkey, like a one-off survey that you could administer the survey, get the data in, and there's a lot of analysis and work that you can do right inside that dashboard. And it's very low cost, it's very accessible. But where we're going, because what we've realized is more people want to track their networks as they grow and evolve over time. So kind of one-off evaluations are valuable, but they're also super limited. And so while we do a lot of those for people, that's actually how we keep the lights on at Visible Network Lab, but we're also trying to move our own community into this data tracking and learning system where they will come in, put their list of partners in, and we're trying to build really good quality, reliable data collection mechanisms so that people can track it over time and go and track their phases. So we're hoping to have that all incorporated over the next, 4 to 6 months, because it's kind of been something that we've learned ourselves. We work a lot with communities, and so when we learn from communities, we try to take that and rebuild it back into our programs. And those phases, I wish I had a slide of this. My team is so excited about, we have this little slider that we're trying to build in that basically you can slide it over time and you can watch the network change over time. But because we're helping people think about the measures that go into it, not just a map. You can get beautiful maps and beautiful map software all over the internet. We really focus on the data that go in and helping people get really good measures to help them know about those things. So if you go to partnertool.net, you'll see what it is now, which is mostly a survey feature, but keep following it because pretty soon here it'll be changing. And not to sound too salesy, but we do have a demo tomorrow morning at 10 a.m. If you go to our website at visiblenetworklab.com, under the tech tab you can find the demos, and we're doing one just on the tool tomorrow for how people can use it. So there's a resource there if you need one now. Right away.
Thank you, Danielle. That is so cool, and I think we're looking for more questions from our FRHP folks, so please go ahead and use the text box, or you can star 2 to unmute your phones. It'd be awesome to hear your voice as well. But I wanted to say, Danielle, that one of the challenges of networks is figuring out how to measure the collaboration aspect. And as you said at the very beginning, there's so many words that describe a network, but they all are, connections of nodes with relationships between them. And how can a network leader and how can a project officer and funders know that collaboration is making a difference? And that evaluation piece is very important. I'm thinking it's one of the cool things across all of the programs at FRHP that are encouraging network development and formation and sustainability.
Yeah, it's a great question, and actually it's where I spend a lot of my time trying to figure out how do we make really good use of all of the work that goes into getting these kinds of data so that we can translate it into practice, both to understand things like the return on investment that funders are making and that our people are making inside that network, and then also to link that to outcomes and effectiveness. And I will say, Cap, I know the work you all are doing is pretty incredible and neat, and so you'll understand probably also that it's always a thing that we're working on. But what we did to try to get better at that is when we built the partner tool, which is when I was a policy scientist at the RAND Corporation about 12 years ago, right during that wedding time. And that's when we developed the partner tool. And the way we developed it is we went out to communities and we did a ton of qualitative research. And we asked them what was important to them in networking, how did they know it was working well or not, and just really listened. And then we built out the first partner survey, which is it's actually a 19-question survey that has what we think are the best questions that you can put into an evaluation framework and ask people in a network to answer to get the kind of information you need to answer those questions you just asked, Cap. So these are questions like, people told us that trust mattered, So we did a lot of work, and we have a scale of trust in our default survey. We have a scale of value because people said, I will come to these networks when there is value for me and others, and we needed ways for people to be able to kind of articulate when that value existed or not. We have questions that measure perceptions of success and outcomes and things like that. And so we also have an evaluation framework that goes beyond just the picture. I love the pictures as much as everyone else, but I think sometimes we get a little hung up on them. What's so important is to understand the value and the magic of the data behind it. So we have an evaluation framework that goes from looking at the structure and the interrelationships to looking at the quality and content of those ties based on, for example, that default survey, which, like, if you went into the partner tool, you can pick to use that default survey in your evaluation, or you can modify it, or we've created, because of our own projects, like 10 to, I don't even know now, 15 versions of it. For example, an early childhood systems one, HIV provider one, preparedness, collective impact. So we put together all these surveys for people so they can go in and you don't have to kind of figure out what to measure. So your question is just, Cap, at the heart of what I think is important for us, is making sure that when we do this kind of data collection, it's leading to learning and outcomes that we can report and also make decisions around, so that we know that we're using this network approach in the most strategic way. So the value of having really high quality measures has been something really important to the work of building that tool out as well. So I love the question.
Yeah, and I think, you know, one of the efforts that our team has been working on here as we've been supporting the Rural Health Network development grantees over the past years is asking ourselves, how can we know and help a network and support them as they reach towards being sustained over time, and how can we teach them to be systems thinkers so that they can think about not just all the parts of their network organization, but how those parts interact. And so I think there's such a lovely marriage between an overlay of this presentation you've had today, and particularly that partner tool, with the work that we do from a technical assistance perspective, which is helping a network leader look and see their network and how not just the relationships, and I know that those are super important, but really you spoke to the trust and the creating value. Well, how does a network do that? One of the ways is they create services based off of needs, and then they deliver them really effectively so that people get what they think they're going to receive, and all of that is interrelated. So our sustainability assessment is a lovely conjoined way of looking at both the relationship piece and also the characteristics or structure of the organization itself.
Yeah, and you know, Cap, I think the work that you all do, being with you in a workshop and watching you walk grantees through that thinking and that work, is remarkable. And so, you know, I won't even shy away that I'm like a big data head, and I love science and structure and all of that. And I'm not very good at facilitating people through the process of actually taking that next step. So, and the assessment that you all provide is such a great complement to all of this as well. And so I agree. I think that, you know, it's hard for people in communities and leading this work to find places to build this skill. And you all provide such a neat way for that. And I think we're going to see more and more of it. I would even guess one day we'll have some kind of university degree that's, you know, related to building networks in community, or some version of that. It's very close, I think, to becoming something that people can actually get a degree in, because there's that need for career and skill building for people in the world today. So it's really exciting to be a part of it.
Yeah, it really is, and it's in this complexity of all the change and the speed of, and all those relationships, those weak tie relationships you showed. That image just makes me feel crazy when I see all those weak ties. I like phase 4 much better.
Yeah, usually I say at that point, I say, I don't really care how you as a person manage your relationships, as a person at the personal level, because we all desire different levels of that craziness. But as an organization, we just can't run things that way, because we have what I call them limited relationship budgets. We don't actually line item that in organizations today, but we should, because all of this networking costs a lot. It takes a lot of time and resources, and so when you put it from that perspective, we have to you have no choice but to make sense of that craziness. So I agree.
Great. I'm going to do one more call out to our folks on the line, either through the chat box or *2 to unmute your phone if you have any questions for Danielle around strategies for building strong networks or anything else about network science or her tools. As you are thinking about those last questions, I'm going to shift to our very last screen. This is kind of our wrap-up screen, and we always appreciate input. And Kiona, can I pass it over to you for wrapping us up? And Danielle, I want to say just how much, again, we appreciate your time and sharing your knowledge and expertise about the science of networks. It's an awesome introduction and much appreciated. So thank you very much.
Thank you for the opportunity.
Yes, thank you, Danielle, for that great information, and to everybody for joining us this morning. Like I had shared earlier, the recording of today's webinar will be posted to our resource library by the end of the day Thursday. Please look for an email from the Network TA team with that link. Before you close out of the webinar today, we ask that you please take a couple of minutes to complete the assessment questions that appear on your screen. I'd like to review just a few upcoming TA reminders that we have as we close the month of September. We have our final September 19th clinical care coordination cohort call. Like I said, that one is on September 19th, which is this Thursday. We are also finishing up our last round of TA check-in calls for those project officers who are on the phone. All of those invites have been sent out. I'd also like to mention that Cap and Shannon will be traveling to Rockville on Wednesday, September 25th to meet with you guys all in